Welcome to the A to 7 Dentistry, A to Z Dentistry. Today we're focusing on the letter P, preventive care. So, what is the background to the story? The why is that one day I went to work and I noticed a lot of children were being put to sleep to have their teeth removed. And I know dental decay is a very preventable disease. And I'm passionate about dental prevention is better than cure. This series is to oral educate everyone, especially families, because I believe knowledge is power. So the background regards children being put to sleep to have their teeth removed. This can be quite distressing for families. So what are we going to do about it? This topic is very close to my heart, and I would like you to at least go through all the slides and learn something from it. There's so much information to be shared. What are the goals? To understand the importance of preventative dental care, tips for good oral health in families, to understand the CAP model of oral health education. Statistic. According to nature.com, 19,381, yes, I repeat, 19,381 children aged 5 to 9 years were admitted to hospital in 2023 to 2024 due to tooth decay. Do you know tooth decay is a preventable disease? So, one may ask, what causes tooth decay? In simple language, in your mouth, we do have bacteria. So, this bacteria, when you eat food which contains sugar, the bacteria in your mouth acts on the sugar to produce acid, and this acid attacks the tooth, and that's what leads to decay. And do you know that the tooth can repair itself? So if your tooth is decayed, your tooth is one of the hardest substances in the body. When it's decayed, it's brown and soft at times. But when it repairs itself, so for example, if you stop eating sweets, the tooth repairs itself and it may show as black. That is what we call arrested decay. So this is how tooth decay comes about. So your diet plays a very important role in tooth decay. Do you know during the Second World War, because there was rationing of sugar, there was less decay as compared to now. Now, people can just walk to the shop and then buy sweets. I'm not saying you shouldn't have sweets. You can have it, but there's the right time to have it. So, for example, if you eat sweets after meals and you brush your teeth properly with preferably a fluoride toothpaste, your chances of getting decay is much less than someone who doesn't brush at all and who keeps on eating sweets constantly. Because what it means is your mouth is always acid, 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 acid. And that's what attacks the tooth and makes the tooth very soft and leads to decay. And we all know when you have decay, the complications are pain, risk pain, alternatives do nothing, which is what a lot of people do. Or you can go to the dentist to have it restored. If you ignore it and the decay spreads to the nerve, that's when it becomes very painful and keeps you awake at night. And the only way to resolve it is to have a root canal treatment with specialist or extraction. Losing your teeth is similar to bereavement. That's how bad it is. And if you have the root treatment, there's no guarantee you may not end up having an extraction. Root canal treatment is saying that yes, I know my tooth is bad, but I do not want to have it removed. It's just trying to buy time. So those are the difference. And the benefit is function, of course, and then the pros and cons. Obviously, if you practice dental prevention is better than cure, it's going to save you money, because if you lose a tooth, you have to spend a lot of money with replacements, and it's not cheap. So it's better to practice prevention is better than cure. And the only way to practice prevention than cure is to brush twice a day with preferably a fluoride toothpaste, spit after brushing, limit sweet to meal times, download NHS food scanner app, visit the dentist regularly. If you're a mom who is breastfeeding, as soon as the baby falls asleep, take the breast out of the baby's mouth. And also, if possible, try and cook from scratch. When you cook from scratch, your ability to put in a lot of sugar is less than if it is bought. And the impact of extraction on families. So, if for example, you've got a child who's got loads of decay, and the child is admitted to have those teeth removed that are decayed, it's going to affect you, because you will have to take time off work to go and be with the child. It will take some time for the child to recover. And as with everything in life, there's always some side effects. So it's better to practice prevention is better than cure. And it can be quite distressing too, because your child is in pain. You have to take time off when all this can be prevented. So you can even use the same toothpaste, that the whole family can use the same toothpaste as long as it's got fluoride in it. So what are the benefits of prevention? The benefits are: one, you save money on dental treatments, you prevent pain, you're able to have healthy teeth, you're able to have healthy gums, and you have a confident smile. Healthy teeth and gums. So if you're a healthy mouth should not bleed. So you can visit the dentist or hygienist for a clean, professional cleaning, and a confident smile. If, for example, you lose a tooth in the front of your mouth, it can affect your confidence. Have you noticed there are some people who hardly smile and may be wondering why don't they smile? It could be they've lost their front tooth and they've lost their confidence, or they are scared of going to see the dentist. The earlier you go, the better. So, what are the daily habits? What are some of the things you can do to prevent tooth decay? Brushing. So, if you're going to be using a manual toothbrush, there's a technique to using a manual toothbrush. Please go for a medium bristle, and you have to hold the toothbrush at an angle of 45 degrees. Use the roll technique and move the gum onto the tooth. Please do not brush horizontally. If you brush horizontally, the gums recede and they don't grow back, and it leads to sensitivity. Sensitive teeth is very difficult to treat. If you are not sure, when you visit the dentist or the hygienist, they will demonstrate to you how to brush properly and how to floss. What is NHS Food Scanner app? So this is an app you can download. You can try it now. You can download it now, especially if you are in the UK. So this is an app you can download from Play Store or App Store. It's got a yellow appearance on App Store or Play Store. So what happens is your phone becomes a barcode reader. So you go to the shop, you scan the barcode, and it tells you how much sugar in the food. It's got recipes, and it tells you what you can swap it for. So for example, I scanned yogurt. I'm not going to mention the brand. And it told me it's got about 3.5 cubes of sugar. And then I decided to scan a big box of cereal. Again, I'm not going to be mentioning the brand. And this brand of cereal, about 500 grams, which is a big box, had 43.8 cubes of sugar. Yes. And it tells you what you can swap it for. So it's an eye opener. So go ahead and download it now onto your phone and have some fun. And please share on social media how you find it or what you found interesting about it. Another daily habit is brushing twice a day. Some people do not like brushing. Brush twice a day, with preferably a fluoride toothpaste and try and floss. If you've got gaps between your teeth, it's advisable to use TP brushes to do that. It's very, very important. If your gums are bleeding whilst you are brushing, then you can go for 𝗧𝗶𝗽𝗀 mouthwash, which is commonly called 𝗧𝗶𝗽𝗀, but it stains at times, so you can use it for a week or two. There's another brand called 𝗧𝗶𝗽𝗀, which does not stain. It is the same 𝗧𝗶𝗽𝗀 mouthwash, but it's more expensive. You can buy it over the counter. Now we're coming to the importance of diet. If you cook from scratch, you're able to know what you put in inside the food. You are more likely not to put in too much sugar in the food. And so it's very important that whatever we take in can affect our teeth. So if, for example, you're someone who takes a lot of acidic drinks, I will advise you to limit it to meal times and use a straw so it goes to the back of your throat. And if you want to eat any form of sweets, please eat it right after the meals. Because we believe after meals you salivate a lot and it washes away the acid. If you keep on eating it constantly throughout the whole day, it means your mouth is being acidic, and that's going to make your teeth get decayed. And if you do not brush, you can still have decay. I'm sharing one of my own recipe with you. This is IG, that is my name, salad. So this is for 2 to 4 people and it can be done under 20 minutes. And I've shared it with you. You can eat it with something else like home baked bread or eat it on its own. So the ingredients are cucumber, lettuce, tomato, onion, a teaspoon of salt, can of sweet corn, can of tin tuna in oil, seasoned all by 𝗧𝗏, pinch, a dollop of salad cream. And then I show you the method of how to do it and enjoy it at the end. You can share the recipe. It will be good to know what other recipes you've arrived at. As a result of this recipe, I founded the 10poundchallenges.com where I challenge families to use £10, go to the shop and prepare a healthy meal for the whole family. Thank you. So, what is the 𝗀𝗃 model? The 𝗀𝗃 model simply means K stands for knowledge. Knowledge is power. A is attitude and B is behavior. All this forms part of oral health education, especially nowadays it's very difficult to get access. Knowing knowledge will change your attitude to certain things and change your behavior. So please let me know if you've learned something from watching this webinar and you've managed to bring about some changes. Please share on social media what you've learned about yourself and what you've managed to change, what attitude or behavior. Thank you. I'm going to be sharing some tips with you. So it's very important to brush 2 times a day with preferably fluoride toothpaste. Spit after brushing. Limit sweet to meal times. Visit the dentist regularly. Floss if you can. If you got huge gaps, use a TP brush. Register your child with the dentist as soon as they have their first tooth, which is normally around the age of 6 to 7 months old. But in some cases, some children may be delayed or early. So it's very important to register them early and get them used to going to the dentist. I'm very proud to say I've seen a child from baby to adulthood and not even a single decay because they took all that I'm sharing with them seriously. Knowledge is power. What I'm sharing with you is oral health education. So share the knowledge and help others. When breastfeeding a baby, as soon as the baby falls asleep, please remove the breast out of the child's mouth. Breastfeed it. missing a D. Cook meals from scratch if you can. Download NHS Food Scanner app. Please share the knowledge, since knowledge is power. Oral health education is very, very important. Thank you for watching. Thank you for listening to me, and see you in the next video. Share the knowledge. Thank you for staying till the end. Please subscribe for updates.